centers across the nation's 6 geopolitical zones, expected to reverse the trend of outbound medical tourism.
They will also operate as the largest chain of oncology and diagnostics center in West Africa. The capacity to train 500 clinicians over 3 years, in addition to enhancing clinical trial and research capabilities.
We know where this huge gap is, and we're working to close it. So we're giving the Medical Laboratory Science Council all the political will and the government to ensure that. Okay,
so I think that one of the things that the government has done is to actually make sure that these things are in place, and I think this is the right way to do it. Trying to make sure that we retain our doctors and not, do the Japa syndrome and go to either of the countries, and I think that's a good one. And if you also look at it, I think that it is very critical that this happens at this particular time. 120,000 health workers, it's a big one.
In front line, and it's also interesting because I remember when it was, getting to an emergency place where you have, equations or ratios of, I think, about 30,000 Nigerians to one doctor or something like that, 3,000, I mean. So it's good to see that the federal government is really concerned and trying to do something about it.
Now let's talk about this. Dr. Laz Ude Eze is a public health physician and health policy advocate and sustainable development consultant. He joins us via Zoom. Good morning, doctor.
Hi, good morning.
All right. Okay, so thank you for joining us. What's your take on the national policy on health as it seeks to stop the migration of skilled health workforce?
Thank you very much. Yes, I think it's a very good policy. It should have been done many years ago, before the COVID-19.
Hello, doctor, if you can hear me, it's a live situation. Hello?
Yes, I don't know if you can hear me.
Yes, continue. Yes, we can.
Can you hear me now?
Yes, yes.
Okay. So thank you very much. So I said before COVID-19 led to increase in demand, especially by developed countries, we've always been having this problem. So the policy should have come much earlier, but it's better late than never. So I kind of like the multi-sectoral approach. I kind of like how it diagnosed the problem and, tackling it from different perspectives. Federal Ministry of Health, primary job is policy, monitoring and evaluation, which is what they've done in this case. But in terms of the implementation, it's not just the job of the federal government. There are much more health workers and also much more hospitals that are under the ownership or supervision of state governments that we have for federal. So for this to be able to work significantly, the states must lead the implementation.
All right, and of course, looking at the present welfare packages for health workers, do you think that this is even remotely possible? Can we do this?
Yes, and that's the question everyone is asking, that, some are of the opinion that, it's not just doing policy, you have to start doing something and not just policies. But I think policy is important because it articulates the plan, and what you don't plan, implementation might get faulty. But the welfare, the work environment is very far from what it's supposed to be. So I do hope with this policy is in place, states will also develop their own policies, to tackle this trend and improve the working environment, And one of the ways to do that is making our primary healthcare to work. And primary healthcare is not just primary healthcare facilities or primary healthcare centers. There is difference between primary healthcare and primary healthcare center or primary healthcare facility. So primary healthcare includes the community component. So Local governments now, with their monies going directly to them, I strongly recommend should invest more in the community component of primary health care. And states need to invest more to ensure that, because when that happens, it's going to decongest the tertiary facilities, which is where we have many of the, experts. And there are tertiary facilities like the teaching hospitals, the federal medical centers are highly overstressed at this time. And no matter what you do, no matter the intervention you make, if you do not make the primary health care work, those facilities will continue getting overworked, and the more they get overworked, the more they want to leave, because they will never be satisfied.
Okay, so you talk about the more they want to leave, because now we're talking about keeping our health workers. What are the issues that we need to begin to look at to actually keep these health workers from migrating?
The issues, the factors are, they are multifactorial. There are issues about the general quality of governance in the country, the general security situation. A lot of times people think that health workers are leaving because maybe perhaps the salary they are getting and all. Yes, it's part of it, but that's not the only reason. Just about a week or two ago, medical students were kidnapped, while they were traveling for a convention. They were kidnapped in Benue State, about 20 of them. How do you convince those people when they graduate and become doctors to want to stay in this country? The trauma of what they went through is going to live with them for long. Just within some days ago, resident doctors, there was a protest, and there is a rating of the number of healthcare providers who have been abducted. One had spent 1 year in captivity, and nothing has been done. So the more this happened, Cross River was notorious at some point where medical doctors and health workers in general, were routinely being abducted. So people don't feel safe enough, and if they have an option, they will want to take it. So beyond issues around the work environment, beyond issues around training, salaries, these are fundamental issues that is not only affecting them, it's affecting everybody in the society. But for those who have demand elsewhere and they have somewhere they can go, it's difficult to convince those ones to stay and face some of these risks. So in tackling this, yes, there are those that the ministry can take care of, as they've outlined in the policy, issues around improving the working conditions, allowances for those who want to work in rural areas, and also training and retraining and all those measures.
Well,
but
Dr. Eze, sorry, let me cut you there. So, because we're running out of time, but crucially, the national policy on health workforce migration emphasizes a collaborative approach. You've talked about it. States have to get involved across sectors and disciplines. So, how do you think we can actually do this? Because you've now outlined issues which is even beyond taking care of the welfare of health workers. So when we talk about collaborative efforts, how can we achieve this?
Thank you very much. That collaborative effort is to communicate this policy properly to the Nigerian Governors Forum, while the governors, perhaps with the Federal Ministry of Health, had to discuss it to the understanding of the governors. I didn't say the commissioners for health. If the governors don't understand it, it will be difficult for even the commissioners to convince them to invest in this, because there must be investment. It will involve money. It will involve funding health sufficiently. 15% going to health, not just procurement or new buildings, but diagnosing the problem, doing needs assessments, and knowing what is required. Every state, have to identify the needs, identify things they can do. They have to engage the health workers unions, Nigerian medical associations, pharmacists, medical laboratory scientists, community health workers, all these groups, so many of them, get them involved, have dialogue with them. What do we need to do to make your work better? What do we need to do to make you save more lives? What do we need to do? Some might be hiring more people. There are people who finish training, they don't get hired, and they have to leave. Some get hired and get paid peanuts. So all these things have to be diagnosed properly at the state level, with the understanding of the governors if they decide to work on this and engage stakeholders within the states, I believe we'll have a good way out.
Thank you very much, Dr. Eze, for the insights this morning. I mean, it's always shocking to find out that there are doctors who don't have jobs in Nigeria. But thank you for sharing these insights. We'll go on a break, and when we come back, we'll have more on this program.
Life is politics. In Nigeria, almost every part of our lives is touched by the politics we play. Governance, legislative matters, the economy, security, foreign affairs, internal affairs. Have a feel as strategic plays in the political space determine how we live in Nigeria. The players, the drama, chess piece moves. Be kept informed. Watch analysis of major happenings in the political space and how it affects you. Watch Politics on Sunday.
Minister of State for Health and Social Welfare Tunji Alausa says there is an urgent need to enforce strict regulations to safeguard citizens, especially in the light of unregulated activities in the health sector.
In light of this, the federal government will establish a National Healthcare Facility Regulatory Agency. The minister made this known at the inauguration of the Technical Team on National Medical Laboratory Regulation and Inspection Against Quackery in Abuja.
In recent times, there has been several discoveries regarding illegal activities in some healthcare facilities, but without the enforcement of strict regulations to protect citizens, the lives of Nigerians remain at risk.
Reliable.
Minister of State for Health and Social Welfare Tunji Alausa says this will change. This will begin with the establishment of the National Healthcare Facility Regulatory Agency to ensure comprehensive and meaningful healthcare service delivery to all Nigerians.
We're moving quickly to setting up a National Health Facility Regulatory Agency that we're going to move. We'll take to the to FEC, and then the President will give us right to go executive bill to the legislature. At least we know where this huge gap is, and we're working to fill that. We're giving the Medical Laboratory Science Council all the political will at the highest level of government to ensure that it carry out its roles, its regulatory roles and function in helping to regulate, accredit, and re-accredit a lab, so that results of that are generated from all the labs in the country are validated results that we will use in providing the right level best care to our citizens.
The minister also highlights the importance of ensuring that healthcare facilities across the country operate within the ambits of the law to prevent any further harm to the public. This will be achieved through this inauguration of a team of regulators and inspectors against quackery in the medical laboratory practice to ensure compliance.
The mandates today, the new mandate that have been given unto us as these technical members, will not fail the nation. In the next 6 months, the story of laboratory practice in this country will change.
Effectively, from now, any lab that does not have the lab information management system should be shut down.
Experts here insist that the current inspection model faces issues such as poor monitoring, inadequate funding, and a lot of misconception about the necessity of inspection. But with this move, Nigerians should be sure of improved healthcare services.
And in agriculture now, a report by the World Food Programme says 25 million Nigerians were at risk of acute hunger in 2023.
To this end, an innovative agribusiness company is leading a project worth 850,000 euros to capitalize on Nigeria's government push for an increase in food production through the processing of local rice.
The project aims to increase the rice paddy yield per hectare to an additional 13,000 smallholder rural rice farmers in Ibaji, Kogi State.
Millions of Nigerian families are facing challenges of food insecurity. The challenges of food insecurity continue to persist as rural smallholder farmers accounting for 90% of the country's food production. With this significant challenge, this agribusiness company is championing a new project which aims to support farmers through the Challenge Fund for Youth Employment Grants. It will provide rural youth with employment opportunities in agriculture and equip them with the necessary skills they need for sustainable farming in the Ibaji area of Kogi State.
Typically what we do is that we go into communities. It's a bit similar to what the anchor borrower is like, but in a much more tailored, much more engaging model, right? Much more community-based model. So we go into the community, identify the communities where we want to work, and then we work with the community stakeholders, engage the community stakeholders, and secure their buy-in, let them know what our project is about, basically to identify viable rural smallholder farmers around.
More than 1,480 young extension service providers will be recruited for the program, and to further enhance its sustainability, communities will be engaged to ensure that the employment opportunities reach the youth that need this intervention the most.
The target is to employ about 1,400, just about 1,400 young people, 50% male, 50% female. It's a very focused, specific project around youth engagement.
The fund is expected to support innovative ideas for improving decent work prospects for youth between the ages of 15 to 35 years.
After this, we'll come back and give you entertainment and sports. We'll be right back.
Life is politics. In Nigeria, almost every part of our lives is touched by the politics we play. Governance, legislative matters, the economy, security, foreign affairs, internal affairs. Have a feel as strategic plays in the political space determine how we live in Nigeria. The players, the drama, chess piece moves. Be kept informed. Watch and